Assalamualaikum everyone. I hope you are doing well. My name is Ifa Farhat and I am a second year medical student at Lahore Medical and Dental College. Today I am one of your moderators alongside Zainu, who is also second year medical student at LNDC. We welcome you to the webinar on USMLE Step 1, Part 2 of Ravish Free USMLE webinar series. These webinars aim to provide comprehensive guidance on the United States medical licensing examination. Before we dive in, I would like to invite Abdullah Farooq, President of Ravish, to say a few words about our organization. Over to you, Abdullah.
Thank you so much. Hello, everyone. I'm very happy to see that you all have attended the webinar. I would like to briefly introduce Ravish before we proceed. So, Ravish is a medical student-led organization that works across 18 medical colleges in Pakistan, and it was formed in August, and it is the brainchild of students of final year LMDC. And what we're planning to do now is we're going to move outside Punjab as well. And so far, we have had over 9 medical camps, ration drives, as well as other activities for the underprivileged communities. Yesterday, I was not able to attend the webinar because I was at an event that was organized by Ravish, in which we painted the whole school, and it was attended by over 60 volunteers, and which included students from over 9 medical colleges. And we're also moving towards human development initiatives such as student education as well. Thank you so much again for attending. Over to you, Zainu.
Thank you so much, Abdullah, for introducing Ravish. Before we move forward, I would like to give special recognition to mbbs Ali, the local cabinet president from CMH Kharia Medical College. Over to you, mbbs.
Assalamu alaikum. I'm Mubariz Ali, and I hope you're all doing great. It's wonderful to see so many of you here today. You're all dedicated students. And at Ravish, our main goal is to support students through these webinars, and we will continue doing so in the future as well. I hope today's session will be helpful for you and also for your USMLE journey in the future. Best of luck, and thank you for being here today. Thank you so much.
Thank you, Mubariz. We are honored to have an incredible panel of speakers with us today who will provide valuable insights to help you succeed in USMLE Step 1.
Our first speaker for today is Dr. Khalid Hussain, a Royal College of Surgeons Ireland Bahrain student who successfully passed his USMLE in July 2023. Dr. Khalid will discuss with us key study resources, strategies for Step 1 preparation. Over to you.
Hello, yes, let me just share slides. All right, good evening and salam alaikum, everyone. I'm honored to be here today speaking to such a large group of dedicated and aspiring medical professionals. A huge thanks to Mubariz, Ravish, and the whole cabinet for inviting me here today. I'm very delighted to share my insights into the USMLE journey. As they've kindly introduced me, my name is Khalid, and I've had the privilege of navigating this journey myself, as well as mentoring students who have gone through their own preparations. So the Step 1 is quite a pivotal moment in anyone's career who aspires to train in the United States. And my goal here is to share with you some practical strategies, insights, and my own personal experiences, which I found most effective in achieving success on this exam. I want this session to be as engaging and informative as possible. So let's get right to it. And hopefully it's not as daunting as it seems. So what I always like to say is that a journey of 1,000 miles begins with a single step. And very much so, the first step in this journey is the hardest. The good news is that it does get easier. It's just finding the motivation and the will to get started, which is the hardest part, for me personally, at least, in this experience. The way I see the USMLE examination is that it's a battle of the mind more so than it is a battle of knowledge. To really do well on this exam, you need to understand the United States medical system, what they're looking for, and really what they're really trying to test. In my opinion, every single person in this webinar has the potential to understand and learn the material needed to do well. But not every single person can get through the most distressing times, get through the phases of upset, frustration, and whatnot to really make it through. And that's what will make the difference between someone who succeeds and someone who doesn't. So it's really important to have that mental resilience and the will to drive forward even in the most stressful times. And for me, there are three important qualities you need to develop before you take any preparation for this exam. The first is discipline, right? There is no right or wrong way to study for this examination. Everyone has their own studying method, and that's, absolutely fine. But you need to make a plan that works for you and stick to it. No procrastination, no delays. You do what you plan to, and you stick to it, right? And the second thing I want to talk about is resilience. This exam, in my opinion, is not designed to test knowledge as much as it is designed to filter out those who are not resilient. Everyone has the ability to do well, but will everyone fight till the end to succeed? That's a question you have to ask yourself. And finally, time management. Everyone has many things on their plate, especially as medical students. But truly, everyone can dedicate time for step one whilst balancing other responsibilities. If I've done it, if other people have done it, so can everyone. So I do not empathize with people who say that they do not have the time, because if you really are dedicated for this process, you will make the time. So to really hammer it home with step one, it's important to understand that the exam questions the why and how and not the what. The what is step two, and that's a problem for another day. So they will very rarely ask you what is the diagnosis or what is the treatment for the disease. But instead, it's an additional layer of thinking. They'll say, what is the pathophysiology of the underlying disease, or what is the mechanism of action of the first-line treatment? So it's really going down to the roots of medicine and learning how things work and why things work, and not what it is. So for many people, including myself, I found this to be more challenging than step two. And always consider this when studying for your exam, because this will really make a difference in how you approach things. So how much preparation is enough? This is something which is very individualized. Many people take 8 months to a year from my experience. I personally took 6 months, and I believe you can do it in 6 months, and frankly, maybe even less. It's just, again, discipline, resilience, and time management. If you can stick to your own studying methods and, commit to it, then I have no doubt you can study effectively in 6 months or less and do it. So preparation for the step one can be divided into two parts, the actual studying resources and the question banks. And the studying resources, it depends what type of learner you are. Most importantly, are you someone who writes notes? Are you a visual learner? Do you use Anki? Do you read? Everyone has their own way of studying, and that is absolutely fine. What I'm going to do now is I'm going to share what I found to be the best resources for each of these studying methodologies. What may work for one person may not work for the other. For example, everyone loves Anki. I personally can't use Anki. It never worked for me. It never stuck with me. But other things worked for me. And again, what will get you past the finish line, and I keep emphasizing this, is discipline and resilience. So starting off with the visual learners, and this was me personally and what worked best for me, Boards and Beyond. This was my personal reference source, my primary reference source for the step one. And Boards and Beyond is amazing. They're lengthy videos, but they go through everything you need to know for whatever is being discussed. You won't need more than what, I forgot the doctor's name, but you won't need more than what the doctor discusses in his videos. And that was quite effective for me. And another one which people often use, and I've also used and found that it helps, was Pathoma. So Pathoma, especially chapters 1 to 3, is very high yield for the exam. All of Pathoma is useful, but if you had to focus on any specific chapters, I'd say 1 to 3 would be the most pertinent. Pathoma has a book and Pathoma has the videos. The videos are quite useful as well. A lot of people have struggled with biochemistry. And this is, I think, the most challenging part of the whole exam. No one likes it. No one likes studying for it. The good news is, from people I've been talking to, they really cut down on the biochemistry questions. They're now tested much less compared to previous years, which is a good thing. But Pixorize is a good resource It's like Sketchy, but for biochemistry. So if anyone uses Sketchy and they like it, they'll definitely love Pixarize for biochemistry. And of course, Sketchy, the go-to for microbiology. I've used it. It's great. So these resources, and just for a reference, every resource I discussed today, it's not meant to be taken from A to Z, right? That's just impossible to do, in my opinion. In my opinion, the best way to approach it is find out your weak areas, and you use these sources, these resources as references. You go to them when you need help on a specific topic, right? And because just going through everything is just absurd. That's very difficult. And the rest and whatever you consider yourself relatively strong in, you'll hone even more during the question banks, which I'll get to in just a bit. So Anki, I personally don't use this. I know a lot of people use this, and it's great. If it works for you, then for sure go for it. Anking is the thing I've heard of the most. I know it's helped a lot of my friends get through it, and a lot of people from my institution get through it. Zanki is a relatively older one. I've heard Anking is better, but they're both great from what I've heard. And reading, you typically throughout my medical journey, I've always been the reader, more so than visual learner than anything. But when I figured out the sheer content needed to study for the USMLE, that wasn't going to cut it for me. I had to resort to something else, which was, and this is also another piece of advice. You need to be innovative, right? This is not like any exam you've ever, this is one of the hardest exams in the world. Not the hardest medical exam. This is one of the hardest medical exams, one of the hardest exams in the world. So you really need to try new things which work for you. So the thing people make a mistake, honestly, the USMLE Step 1 book is very overrated, in my opinion. It's a lot of people read it from A to Z, which from my experience doesn't work. It's, again, a reference book, and it's more so useful to use towards the end of your preparation if you just want to run down something very quickly for a quick review. Although at the end of the book, there's like at the last few pages, there's a quick summary for keywords and the diagnoses, which is quite useful actually. And the Pathoma book is very good. And towards the end of the preparation, this is something not many people know, are Melman documents. You just search up Melman USMLE Step 1. And honestly, this came in quite clutch for me in the days preceding the exam. I got a lot of questions from these documents. Basically, what he does is this Melman guy, he summarizes everything, and he makes it very clear and just shares the high yield points. This is useful for like the weeks leading up to the exam. YouTube and podcasts. So, this helps for a lot of people. Hi Guru is one that really helped for me. I thought it was very detailed and thorough. I definitely recommend him if you're into YouTube. And Randy Neal is very good for biostats. A lot of people praised him for biostats. I've looked at a few of his videos and I thought it was pretty good. And the new thing that's kicking off as well is Divine Intervention podcasts. This is more used for Step 2. It's more popular in Step 2, but you could use it for Step 1 if none of the above are working for you. And another thing which is taking off recently, I haven't used this, but it's a new thing recently, is USMLE Bootcamp. It's like an online website. I think it's a podcast. And a lot of people have said great things about it as well, although I've personally never tried it. So the question resources. So once you hone your studying and your content, at least, it's really recommended. The best way to study is to do question resources, right? And time is of the essence, right? Everyone says UWorld, but if you plan to take the exam a year from now, you're going to waste your gold standard question bank. So, as I said as well, it's recommended to start this synonymously with the studying resources or shortly after if you feel like you need to read up a bit more. So, of course, UWorld, the gold standard of USMLE questions, should be your first and foremost resource, but do not waste it. The questions are limited. I think there are 4,000 questions now. If I'm not mistaken, it could have gone up. And, start within a reasonable time frame from the exam date, right? Have a date in mind before you do all this, before you start this journey, okay? And whatever happens, don't move the dates. Just move everything else around it if feasible. And it's important to learn and understand from each and every single question that you do. So NBMEs, this is the best mock exam resource, very limited. I think there are 6 up-to-date ones. The rest are all old and not really relevant. I don't know if that's changed now, but you should really preserve them for a true evaluation of your progress. So one should be done ideally shortly after starting your world, and the other after completing it, right? And like the rest in between, right? So that's, in my opinion, how you should divide it. It all depends on the date you have in your mind. The UWorld self-assessments, this is different from the question bank. This is the mock exams. They're also very high quality. They're pretty good. You should use them just like NBMEs and divide them as such as well. Some of them are quite predictive too. Additionally, we have the free 120. This is the closest thing to the exam. This is done by USMLE itself. The questions are written by them, and you won't get anything as close to this. But the thing is, they're only 120 questions. So this is like the final thing. You should leave this for the days or weeks, well, not weeks, I think days leading up to the exam date to really assess your progress. There's no scoring system, just a percentage. Typically, if you get 75% or 70% plus, you're in the safe zone with the free 120. But this is the closest thing you'll get. There's also AMBOSS Self-Assessment Week. So if any of you are familiar with AMBOSS, a few weeks in the year, they host like a week where there's a mock exam for step one. It's relatively predictive from my own anecdotal experience. They're high quality, although in my opinion, they're a bit more challenging than the NBMEs and the UWorld self-assessments. The scores are curved, just like the real USMLE exam is, so that's a great thing. But the only problem is that it's dependent on your level of knowledge at the time this time frame happens where they release the self-assessment week. Often, from my experience, when I did it, the self-assessment week was in February. I didn't know much at the time, but it was still pretty good. I thought it was pretty good. So other options for the question bank. So Kaplan, I used Kaplan. I thought it was pretty good. They're quite challenging actually, but my opinion is if you're starting a long time before you plan to sit the exam and you want to preserve your world, Kaplan is a good one, I think. And USMLE RX, this is useful at the very, very start. They lay things out very simply, and they don't really, like test the more detailed stuff. But it's very good to start. I used it as well. I thought it was pretty good. And AMBOSS, not the self-assessment, but just general AMBOSS questions. They're pretty good, but they're very challenging and they try to catch you out. In my opinion, it's not much like the exam, but still pretty good if you run out of options. And I want to end off with this. I know that I am intelligent because I know that I know nothing. That's a famous quote by a Greek philosopher. This exam is not designed for you to know all of medicine. It's a test of resilience, discipline, and determination. You just have to, force your way through the fear, and you need to build confidence, and with that, you will succeed. Do not delay. Have a plan. Stick to it, and stick to your plan religiously. Like be very stringent on it, and study using the resources that work best for you. Right? What may work for me may not work for everyone else, and vice versa. And thank you. That's all I have from my end.
Thank you so much, Dr. Khalid, for sharing your comprehensive study methods and recommended resources. Your insights are beneficial for the students who are preparing for the Step 1 examination. Thank you so much.
Next, we will be having Dr. Reda Asim, a graduate of Karachi Medical and Dental College, who recently passed her USMLE Step 1 exam in August 2024. She will be covering the exam format, question types, and the effective use of practice tests with us. Over to you, Dr. Reda.
Okay, first of all, I would like to introduce myself. I am Dr. Dasim, and I just graduated in Feb 2024, and I recently passed my step one. And I would also like to say I'm really honored to Ravish for having me and Mubaris for reaching out. And basically, I tried to compact all the information that I wish I had that I did not get from Reddit scrolling and everything, and I hope this is really informative for you guys. So my topics of discussion will be my study strategies, practice tests and exam formats, and question styles. Okay, before I go through study strategy, I want to say mindset is really important, that I feel like a lot of students lack, is the fact that studying is supposed to be hard. It's like exercise. If you don't go through the hard things, you're not going to gain anything. So one of the theme is, yes, we're humans, but when you're going to get bad scores, and you will, do not cry about it. Change your mindset to like, okay, मैं मैंने इसमें इतने सारे गलत किए हैं, but oh my god, I'm going to learn so much, because your study strategy is the backbone of your preparation. If you do not have that down, then, well, you're going to face a lot of difficulties. Okay? And the one study strategy I'm going to recommend, there's a lot, but this one's crucial, is that you're going to cherish your U world incorrects. Listen, people go into U world and they go like, we're going to learn in the second pass or the third pass. No, you do the first pass and then you ingrain it into your soul. You do it efficiently. ठीक है? Second, third pass is like, आप कह रहे हो कि first pass peruse karunga, but no, you have to actively learn. Now you're wondering, okay, how are we going to do that? Now listen, you're going to go on YouTube, sahi hai, and you're going to see people doing 80 and 120 questions per day. But the thing is, unki quality kya hai? Is there quality? Like, there are a lot of people who can go through stuff quickly and retain it and understand it, but this is very individual. If you're doing 30 questions, ठीक है, the entire day, but you did them correctly, ठीक है, तुमने उनका concept समझा, ठीक है, you went through all of the explanation, you figured out why this is not it and why this is the answer. Trust me, when you do your NBMEs and when you go through the actual exam, you're going to come out so happy because you spent time doing those 30 questions, ठीक है, rather than doing 60 bad quality questions. ठीक है? So remember that it is not quantity, it is quality, because I went through that where I went like, मेरे questions नहीं हो रहे, मेरे ज़्यादा questions नहीं हो रहे, but the questions I did, I ingrained them in my soul. The concepts are really important. Now the second thing, how incorrects का करना क्या? Listen to me. What you're going to do, you're going to paraphrase it, ठीक है? And you're going to screenshot the explanation in an MS Word file or a Notion. I'll show you an example later on. And then you're going to review it every single day. And that is where spaced repetition comes in. Okay, spaced repetition is कि आप increasing intervals पे अपने incorrect review करेंगे रोज. Every single day. You will not have one break from it. Okay, I used to do it. I used to get up and then I used to do them before my blocks. And trust me, it was my long-term memory and my muscle memory, and I got amazing NBME scores and my exam went without a hitch. So you can use Anki for it, or you can make your own system, whatever works for you. But do not forget spaced repetition. That is like the most important part of your prep. Okay, that's your most effective strategy. Listen, active recall is your U word. आप कितना भी videos देख लो, but unless you know how to apply your knowledge, it's not going to work. And unless you work hard to retain that knowledge. ठीक है, a lot of students, I've seen so many posts and they go like, we're not retaining anything from U word. It's because they do not do spaced repetition. This is how you're going to do it. This is how you're going to get everything out of your U word. Okay, again, how much time should students dedicate to studying? Step one, again, it depends. Okay, I gave a dedicated 6 months where I just did nothing but step one. But it's a very subjective thing. It depends on your core concepts. It depends how fast or slow learner you are. But in the last dedicated period, that's all you should do. You should breathe and eat USMLE. Say 10 to 12 hours, generally you'll come to a point where it won't even feel enough. And one more thing, a lot of people will go like it's pass fail, but I feel like that's not correct because the exam is a beast. It is a boss level. And unless you give it its due, just don't leave anything to chance. Do your best and then leave it to God, but you do not leave it to chance. Okay, let's talk about practice tests. Okay, you've efficiently done your U word. Around, I would recommend 60 to 80%. You do your NBME 26. ठीक है, पहले total होते हैं 25 से लेकर 31 तक, and then there's free 120. However, a lot of students I think do 21 to 24 as well. I didn't do it. do them, but do 25 to 31 all of them. Okay. Now these were the questions that I had. So these are the ones that I thought were really important. Which one should you take first? I believe NBME 26 was recommended to me, which was good. It's kind of medium difficulty and it tells you where you are. So I would say that 25 works too, but 26. Okay. A lot of students ask, okay, how do I know I'm ready? It's you won't be ready. That's like a trap. Do not go like, okay, I want to revise everything before my NBME. Don't do that. Okay? Because लॉन्ग टर्म मेमोरी इज योर फ्रेंड. ठीक है, एग्जाम में योर लॉन्ग टर्म मेमोरी आपके काम आती है. शॉर्ट टर्म मेमोरी इज दैट इट्स शॉर्ट. ठीक है, आप कितना भी कर लो, एक दिन पहले जो तुम्हारी 6 महीने की मेहनत होगी, इट कैन नॉट रिप्लेस द वन डे short term things you revise, unless it's like pharma etc, then can't do anything. Okay, what percent should you be getting and comfortable? देखो, aim high. सही है, 70% and above. Like I said, my strategy was you do not take chances with your prep. Aim high and set a lower threshold as well. कि मुझे 60% से कम नहीं करना. I will not go below this. ठीक है, and if you're scoring low, then fine, after a period of panicking and being sad, you go like, what is my problem? ठीक है, you use NBMEs to test yourself, really test yourself कि आपकी problem time management है, or do you not understand the concepts, or do you not understand the questions, or are you really anxious? Because a lot of people with really good knowledge are bad test takers. So you utilize your NBMEs for that. ठीक है, you hone your skills. Now again, how do you review NBMEs? ठीक है, because a lot of students have a hard time with that. Again, ठीक है, जो मैंने UWorld की strategy बताई, you do that for NBMEs. आप अपने incorrects review करोगे, screenshot them into your Notion, and then you space repeat the heck out of them. You ingrain them in your souls, and not just that. ठीक है, you do not just do the incorrects. ठीक है, you go कि okay, this is a topic. What else can they ask? ठीक है, because अब अपनी prep में इतना आगे आ जाते हो that you can easily figure out, like an examiner, what else can they ask me from this? What tricky thing am I forgetting that they can ask me? ठीक है, and okay, this is an example. This is my Notion. ठीक है, and this was my NBME 31. You see what I did. This is a paraphrase question. All of these are. ठीक है, and this is all in one place. ठीक है, and I had a traffic light system. ठीक है, yellow meant I had to do them again, but this entire thing is green means I know it from heart, and red meant के मुझे नहीं आता और मुझे फिर से करना है. Okay, this is how I explained it to myself. ठीक है, and I made more questions for myself. ठीक है, and this is how I took a screenshot. You can do this in MS Word and Notion. It's not hard, but you need to have a file with all your incorrects जिसको तुम रोज review कर सकते हो. ठीक है, अच्छा, now question style. Okay, what is the typical question style in step 1 and how can students effectively approach them? देखो, one word is long. Step 1 questions are long. ठीक है, so the thing you need to learn is you need to skim, read fast, and you catch the relevant details. देखो, इतना वक्त नहीं होता that you spend 10 minutes figuring out कि क्या करें, because they fill it up with irrelevant vague details that they're using it to confuse you. You need to catch those 2 to 3 sentences or words and go like, ये answer है, and you go forward. ठीक है, because you don't have time and you're going to develop these skills over time. UWorld will help you, NBME will help you, so you'll get to that point where you can assess yourself. ठीक है, and free 120, like Khalid said, that is going to prepare. You're going to, it's exactly like that. जितने लंबे questions उसमें होते हैं ना, उतने ही लंबे questions do not mean difficult questions. ठीक है, but the entire point of लंबे questions is that they waste your time. ठीक है, so that is the point. ठीक है, okay, again, this is my advice. A lot of students don't do that, but it really helped me. You read answer choices first. ठीक है, so you go into the questions kind of like थोड़ा बहुत अंदाजा हो जाता है कि अच्छा I need to do ये पूछ रहे हैं. ठीक है, because in the actual exam a lot of the time I got the answer correct because I was like maybe they're trying to ask me this, but this is subjective, but this is my recommendation genuinely कि आप answer choices पढ़ो फिर question पढ़ो. Okay, now the age-old question: how similar are the questions to NBMEs and UWorld? Okay, now the exam is an exam in itself. एक beast है, ठीक है? देखो, question length is UWorld. Concepts may be NBMEs, but a lot of the concepts are from UWorld as well, and the exam is from everywhere. ठीक है? NBMEs are a good estimate, but the exam is just from everywhere. और अगर आपने अच्छा पढ़ा हुआ होगा, then it's fine. You won't. It's the exam is doable. ठीक है? हो जाएगा. Okay, breaks. Acha dekho, breaks were a little surprise for me. That is why I thought I would mention this. I was like, one block, 5 minutes, one block, 5 minutes. But what I felt, each break wasn't cut 5 minutes at all. 6, 7 minutes आराम से लग जाते थे. ठीक है, and you're going to feel that my break time is running out. So don't panic. ठीक है, just keep it in mind कि 6, 7 minutes आराम से लगेंगे. It's pretty individual. आप अपनी उस वक्त assess yourself, see where you are. ठीक है, if you can do another block, do it, but have a plan beforehand as well. ठीक है, and again, the thing is, the exam, more than your knowledge, it is going to want to break you genuinely. But जब आप इतनी मेहनत करते हो ना, you're going to prepare for this like really hard. आपकी adrenaline, perseverance, your mindset, and genuinely end में आप ऐसे हो जाते हो कि I want to get this over with. A little bit of that too, and you're going to pull through. Okay, and most important thing is कि you give your 1000% and you pray with everything you have. ठीक है, genuinely, and then when you pray और आपने अपना 1000% दिया है, then inshallah you're going to succeed. And that's pretty much it from me. And I hope you got good insights from my presentation, and we'll be taking questions at the end. Thank you.
Thank you so much, Dr. Rida, for breaking down the USMLE Step 1 format and offering tips on handling the practice questions. Your advice will help students fine-tune their strategies. Thank you so much.
Next, we have Dr. Arij Fatma. She is a student of Islam. She's a graduate of Islam Medical and Dental College. She passed her step 1 also in August 2024. She will be discussing with us test day tips and tricks, time management strategies, and any problems or issues that that happen during the test, ways to handle them. Over to you, Dr. Arij.
Okay, thank you. Assalamu alaikum, everyone. I hope you guys are doing fine. First of all, thank you to Ravish for having me and Dr. Mubarak for giving me this opportunity. First of all, my name is Arij Fatima, and I have recently passed my USMLE Step 1. I'm a graduate of Islam Medical College, and I graduated in 2022. And today, can you please move to the next slide? Okay, so today I'll be giving you advice regarding how to handle stress and exam day tactics and techniques that really helped me. And I'm going to tell you that how you are going to manage your stress and how you're going to manage your time during the test day. And it really helped me. So definitely is going to help you too. Okay, so first of and foremost, believe in yourself. The most important thing is the belief. Be confident because you have done enough hard work. You were preparing for so long, and you know you have done anything that could be done possibly, and you just don't want to, your anxiety to take over it. And you know what, actually, stress and time management are actually the two most crucial aspects of your exam, and both of which can affect your performance. So you don't want to ruin it because of your stress. And so the first thing is day before the exam. You need to know the strategies. What are you going to do before the exam? And you need to prepare yourself for the exam day. And so you should know that what to do a day before exam. So what you're going to do a day before the exam: wake up early, wake up as soon as possible, because if you wake up early, you are going to tire yourself up so you can sleep early and have a good night's sleep. So wake up early. If you're someone who offer prayers and believe in that, so wake up and offer your prayer, have a healthy breakfast, and do not eat anything that is, make you sleepy or something, but that is light in weight and also boost your energy. So, okay, so a day before exam, there is nothing you can do much. You have done your first aid, you have gone through it, and you have done your NDMEs, you have given your free 120, and you know where you stand at that point. So you don't need to burden yourself, and don't burden yourself with negative approaches. Don't try to learn anything new. Just stick to what you have already learned, believe in yourself, and everything is going to be okay. So one more advice, I see people giving their free 120 a day before exam. That is something I believe that should not be practiced, because if you're not scoring good in free 120 a day before exam, that is really, really going to uh, create unnecessary anxiety. And you should have done your free 120 a week before, or even before than that. Okay. Okay. You know, the cheat sheet is really going to help you. If you are someone, at the last day, what you're going to do is make a cheat sheet. You can make it before that day, but if you have not made it, make it, and you can write all the biostat formulas in it. So in this way, you can easily go through it, and you can go through those formulas before going to bed and without any distractions. So do, yeah, if you're not writing anything else, nothing else, just do write the biostat formulas, because they are something that need to be revised again and again and again. So, and if you are someone who want to go through something, you can revise rapid review notes that are present at the end of the first aid. But do remember, do not try to memorize anything. You have learned anything, everything, you have everything in your, long-term memory. So you don't not want to memorize anything. You just go through it, just and that's it. Or you should be done with all these stuff by 5 in the evening, and they just shut everything, stop studying. What can you do? You have done everything. Like, you were preparing for 6 months, or maybe you were preparing for it for 1 year. What else can you do now? You are done with everything. Believe in yourself. And everyone have their own ways of coping up with their anxiety. So if you're someone who like to talk to their family, if you have anyone among your friends who can make you feel better, anyone among your family, talking with your parents, that always helps. So sit with them, talk about anything, and anyone who can make you feel better, someone who can motivate you, someone who can cheer you up. Sit with them, have some time, and that's it. You cannot do anything else. And most of the people I see, they don't learn, they don't even open their book at the last day. So it's okay if you're not opening anything, and that's okay. It's going to be okay. Okay, and one thing, listen to me. Stress, anxiety, and being worrying, that is totally normal. That does not show that you're weak, or you're something you're not prepared. As Dr. Rida told, that you may not feel ready. You may not even feel ready when you're sitting for the exam. You may not feel ready, but that's okay. That's pretty normal. So you should, but you should take necessary steps to manage your anxiety, stress, and you don't want anything. You don't it. It's a beast, and you don't want anything to ruin it. It's an exam which is, you can say, it's 60% of your knowledge, and it is 40% how you deal with your stress, how you're going to manage the day of your exam. So, okay, and one more thing, what you're going to do a day before exam: gather your all important documents. You know what you need? You need your scheduling permit, you need your passport, ID card. Just gather them at one place, so you're not rushing at the last point. And remember, you will not be allowed to sit in the exam if you have not your valid ID card. So keep it with you. And yeah, snacks, that are very important part, so you should pack them in a shopping bag or whatsoever, so you can take it with you. And sleep is sleep is very, very, very necessary. Try to take 7 hours sleep. And if you're someone who like exercising, if you are done with everything, just before sleeping, you can have a 15 minute of exercise, that can tire you and just tire yourself, so you can sleep better and wake up early in the morning on your exam day. Okay, yeah, day of the exam. it's going to be really stressful. It's really going to be stressful, but it's okay. It's fine. Wake up early. As I said earlier, if you're someone who believes in prayers, I personally believe a lot in that. So just offer your prayer, or if you have any other, you practice any other religion, you can also go with that, whatever is your convenience. Try to take a nice shower. That is really going to help you calm, and eat some healthy breakfast. Do not try to eat something very you don't want to eat some halwa puri so that you are sleeping all over your exam. So these are the basic things that one should do, and these are very, very, very basic. So, and one thing, what you that's a very most of the people think that, oh my god, what I'm going to take with me, like apart from your ID card or passport or anything, what are the snacks I'm going to take with me. So I'll recommend you to take some bananas with you. You can take some dates, and do not take many things because you're not going to eat. Trust me, you're not going to eat much. Just you're going to eat a date in your break, and that's okay. And you can also take some water with you. Yeah, you should take some water there. And the Prometric Center, their cooler is available. You can have water there, but it's better if you're someone who is a chai lover and you want to have chai or coffee, you can also take it with you. Okay, and leave your home as early as possible according to your route. You should reach the Prometric Center 1 hour before your exam starts. Okay, because you cannot but you don't want any mishap to to happen on this day, because it's a very, very important day. That's the day your future is going to be decided, and you have really worked hard for this day. Or try to wear comfortable clothes. And also, yeah, if you're male or female, do not wear something with which have a lot of pockets, because as after every break they have to do checking, and they'll just waste your time. So just save that time for yourself. Okay. Okay, once you're seated. Okay, when I seated in my exam, I was really confused. My hands were shivering at that point. But as soon as I started, you know, everything went normal. And I was shivering at the starting, but took some deep breaths and everything went well. Okay, so there is no time of being anxious. You have to respond like a machine. You have to respond in minutes. So nerve control can make or break your exam, and you don't want anxiety to ruin everything. So just control on your nerves. Okay, next slide, please. Okay. So you might be seated, you'll be in anxiety, and but do remember, keep reminding yourself that, oh, it's just a 40 questions block, and then I'm going to have a break, and it's going to be fine, and it's going to end. If you keep thinking, oh my god, it's going to end, oh my god, it's going to end, that's going to keep you motivated. When I was sitting in the exam, I was, after each block, I was like, oh my god, I have like 4 blocks left, and everything is going to be fine. It's going to end. It's going to end. So that is something that kept me motivated all through the exam. And I was, at the last block, I was so happy. I was like, oh my God, it's going to be done. Or, okay. So while picking an option, trust your gut, because you have learned everything. You have, everything is in your long-term memory. So do not second guess unless you're 100% sure, or you have read the statement wrong. Do not second guess. Do not, because you have everything in your long-term memory. And what is your first guess? Like in 80% of cases, that's going to be true. Okay, how to utilize your exam breaks. That's a very important thing. And Dr. Rida just told you, but I'll be adding something more. Okay, can you move? Okay, so it's an 8-hour long exam, and 7 hour of exam, and you have 1 hour of break. So what I'll suggest, take a 5-minute break, or you can take more, that's fine, after each block, just to refresh your brain. Even if you feel fine, you may think, oh my God, I'm fine, I'm going to do it, I don't need a break. But see, we all are human beings. We need to refresh our brains. So I'll recommend you, even if you don't feel it, go for the break. What you're going to do in that break, just eat something, just have some water, stay hydrated. You can, splash some water in your face. You can do some stretching. You can just walk, just to refresh your brain, because you might have an easy block, but you don't know what's coming up. So I highly recommend that you take a break. Do not think that, oh my God, it's fine. I'm going to do 2 blocks together. I'm going to do 3 blocks together. No, take a break, relax yourself. It's okay. It's okay if you're going to take a break. And stay hydrated, and it's going to be fine. Next slide, please. Okay, so we are now going to talk about how, you are going to deal with the questions. See, remember, you're not going to, you may not know answer to every question, and that's completely all right. But you keep in mind that there are going to be some experimental questions. So if you are not getting any question, you're like pretty confused, oh my God, what kind of question it is. It's okay, because there are going to be lot of experimental questions, and those questions might not even count. So if you're not getting anything, stop wasting time on that question and just think that it's okay. It might be an experimental question, and just move on. And, what are you going to do with the biostat calculations? Okay, so keep those questions by end of the block, because they are more time taking, and you do not want to, skip other questions that might be easier and less time taking. So flag those questions and do the biostat calculations uh, at the end of at the end of the block. Okay, there are going to be questions with very long stems. Like you might see a question with 15 lines, and you'll be like, what is this? You know what? You are going to quickly read the last line of the question stem, skim the options. You might see some keywords, focus on those, and they're just trying to confuse you. So you're not going to be confused. You don't want to be confused. So you're going to be get the idea of the answer very quickly. Or do not sit and keep on staring a question. There is a question and you are like, I don't know this question. And if you are taking 1 minute, you are taking more than 1 minute on a question, skip that question, flag that question, and leave it for the end. Okay. Make an educated guess, mark it, and move on, because you might know other questions and you don't want to waste your time on that specific question that may be an experimental, that might even not count. Okay. Okay, so you are done with the exam now. You are out. You are done with the beast now. You might have mixed feelings. You might think about all the wrong questions you got, and that's okay. That's normal. Until the result came, personally, I kept dreaming of all the wrong questions that I got. And I used to dream, oh my God, I might have failed the exam. And that's pretty normal. You're going to pass, because hard work never go unnoticed. So as they say, there are no secrets to success. It is the result of preparation, hard work, and learning from failure. You might have learned from NBMEs. Might have even failed some NBME, but you are going to learn from that. So at last, all I would say that if I can do it, if an average person like me can do it, anyone can do it. You are way smarter than me. You are way more hardworking than me. And thank you. That's all from my side. Thank you.
Thank you so much, Dr. Avij, for your valuable advice on managing challenges during the examination. Your tips will certainly help boost the confidence of many attendees. Thank you so much.
Now it's time for our Q&A session. I'm going to take questions from the chat box and I'll address them one by one to both of our speakers. So the first question I have is for you, Dr. Ida. Is there any alternative to BNB?
The thing is, there, I don't know if you guys have heard of them, but there are physio videos. It's PHYSEO. Okay, physio videos. They're amazing. Okay, There were a few topics I wished I watched them from the beginning, but DNB is fine. I watched all of it, but physio videos were the ones that honed in on the concepts that I was really lacking. Use it for neuro. Okay, neuroanatomy really helped. Cardiology, physiology, all the physiology things, do those. I really like those videos personally. If you should try them out, I believe they'll help a lot.
Thank you so much, Dr. Rida. Next question is, it's from Javeria and Anzala both. What is the source for pharma? Kaplan या sketchy?
Sketchy. Sketchy flashcards. You do sketchy, and remember I said you were incorrect. Also sketchy, there are a lot of Anki decks, or you can just मैं क्या करती थी sketchy PDFs आते हैं, ठीक है? If you don't want flashcards, that's fine. You pick a drug, ठीक है? तुमने कहा PPIs, ठीक है? Then you just write it down. You think मुझे कितना याद है picture से, and then you write it down. Sketchy saved my micro and my pharmacology, especially the autonomic nervous system, especially.
Thank you so much, Dr. Rida. Next question I would like to ask Dr. Arich. How many hours did you study in 6 months preparation period? Basically, question Dr. Khalid के लिए directed था, but he is not in the meeting. तो अगर आप में से किसी का experience 6 months का है, तो वो answer कर this question को.
Okay,
Uh,
let me tell you, if you would ask someone average person like me, so I used to study for like, there were days when I was studying for 15 hours. So if there might be some people who would be studying for 8 hours, but an average person like me might need like 12 to 13 hours, and that's fine. So in the last 6 months, I was like studying for about 12 hours daily. So yeah, 12 hours.
I would like to
Uh,
add to that. I would like to say, don't make आप अपनी pace आहिस्ता बनाना. It's like you can't do, what people misunderstand is that you can't do 12 hours instantly. ठीक है? आपका तो stamina शुरू में नहीं होता. मेरा भी नहीं था. तो you start off with 5. ठीक है? And I would say make yourself a morning person, unless because we have jobs, right? And the timings are really off. But make yourself a morning person. सही है? And unless my friends work better at night, but I'm a morning person, so the morning time is just so good, so you can easily accomplish 4 to 5 hours, and then progress हो जाती, then you आपका आहिस्ता आहिस्ता स्टैमिना 12 आवर्स पर बनता है, एंड तक तो आसानी से हो जाएगा, ठीक है? बट शुरू में don't be so hard on yourself, because I was and I regretted. 5-6 hours is good for the beginning, ठीक है? आहिस्ता आहिस्ता फिर पेस बन जाती है.
Next question is, should we annotate the new material we learned from UWorld or other question banks on step 1 book or on our notes?
अच्छा, I'm not a written kind of girly. मुझे नहीं पसंद handwritten notes. I feel like it's time inefficient. That's why I recommended you do screenshots of your incorrects and you put them in your Notion or MS Word. हाँ, अगर छोटी information हो ना, तो you can annotate on your first aid. I found it unhelpful, and में पता है इतना फर्क नहीं पड़ता. But I would say the U word incorrect screenshots work best. If you are a written person कि जिसको लिखना बहुत पसंद है, sure, try it out, but you'll realize later कि it's pretty time inefficient और इतना फर्क नहीं पड़ता. And don't try to write down जो BNB में extra information वो देता है ना. I did it, and I'm sure a lot of you will still do it, but I'm telling you,
Yeah, same. I did it too.
yeah, I did it. So it was useless. I did not even read my
Yeah,
handwritten notes. I did not read them.
same.
Yeah, so trust me, it does not matter. जो याद करोगे वो you where से करोगे, अपने incorrect से करोगे. First aid से reference book की तरह use करना. Do not try to ratify it. This is not that kind of exam, okay?
Next question here from Zainab. Okay, when to start? Should you book your test if you're getting 65% in NBMEs?
यार पता है, it's pretty subjective. I would aim for 70 above, because like I said, my philosophy was do not take anything to chance. If you're doing 70 and above, then I would be, me personally, be comfortable going for it. But a lot of people on Reddit do with less percentages and they pass. But I'm a very anxious person who doesn't like to like leave anything कि 65% है चलो मैं दे दूंगी तो it's pretty subjective. I would say aim high, do your best, ठीक है, and don't rush, ठीक है. So that's my advice.
Next, Amna ka question hai कि where can we find all the resources you told about? Like, मेरे ख्याल है ये आपसे है, Dr.
There was this entire Google Drive that I shared with my college students, but it got taken down and it had all the resources. I'll see if it's still active and I'll share it with you guys. उसमें सब है, pathoma, physiology, sketchy, Kaplan. It had everything. It was like a mega file and it had every single thing. I'll see if it's still up because it got taken down. Varna medical studies on you what do? You go to Google, you write physio videos step 1 free, and it gives you Afrata free or it gives you medical studies zone and you download them like this. Don't need to pay for anything.
Next हमारा question again Anzala से की तरफ से है कि should one start UWorld right from the beginning of the preparation to use first aid info?
अच्छा देखो, the thing is कि थोड़ा बहुत prior knowledge is fine, but do not waste time trying to learn everything from first aid and then going like अब मैं UWorld करूंगी, कोई फर्क नहीं पड़ता. सही है, मैं तो ब्लाइंडली करती थी. सही है, बिकॉज ट्रस्ट मी, जब आपका इतना ग्लेरिंगली इनकरेक्ट होता है ना, व्हेन यू गेट समथिंग सो सिंपल सो रॉन्ग, यू आर गोइंग टू रिमेम्बर इट फॉर द रेस्ट ऑफ योर लाइफ. अगर मुझसे अभी भी कोई पूछेगा ना कि फिनाइल कीटोन यूरिया में समथिंग अमाइनो एसिड कौन सा होता है, आई कैन गो लाइक टायरोसिन होता है, ठीक है. आई कैन नरेट ऑल माई इनकरेक्ट्स बिकॉज इतनी फीलिंग्स हर्ट होती है ना, बिकॉज videos or first aid man, it's very passive, but when UWorld breaks you, you remember those incorrects. I remember all of them. So I would say UWorld from the first day, go blindly. ठीक है, go blindly, क्योंकि आप जितना भी पढ़ लो ना, it does not prepare you. I still remember my neuro UWorld, you know, brain tumors made me cry, but I remember them now. So
लास्ट मेरा ख्याल है कि सेकंड लास्ट हमारा क्वेश्चन है, ये भी उनजला की तरफ से है. आई रियली अप्रिशिएट हर एंथुसियाज्म एंड पार्टिसिपेशन. व्हेन रिव्यूइंग व्हाट हैज ऑलरेडी बीन डन, हाउ डू यू अवॉइड फॉलिंग इन द व्हाई डोंट आई रिमेंबर दिस रैबिट होल? आई कैन रिपीट द क्वेश्चन. When reviewing what has already been done, जब आप review कर रहे हैं जो आपने पहले किया हुआ है, how do you avoid falling in this why don't I remember this, ये मुझे क्यों भूल गया वाला rabbit hole, like the feeling कि जब आप review.
मैं समझते, देखो, अच्छा, let me give you like an example with what I struggled with. ठीक है, अच्छा, there are these things तुम लोग करोगे. जब कार्डियोलॉजी का मॉड्यूल होता है ना, तो उसमें ऑटोनॉमिक नर्वस सिस्टम के ड्रग्स के सवाल होते हैं which correlate to pharmacology. ठीक है, I got them all wrong despite doing sketchy, and so I covered my ratta part. ठीक है, but मुझे still नहीं आ रहे थे. ठीक है, despite reviewing them as well. Then this one day मैंने कहा आज मैं अपने ब्लॉक्स नहीं करूंगी. देखो, when you get, आपका अगर एक ही चीज बार बार इनकरेक्ट होती है ना, तो instead of falling into the trap, have the mindset कि मसला क्या है, what is my problem, what am I not understanding. ठीक है, तो you spent time, मैंने उन questions पर I think पूरे 2 दिन लगाए थे. I remember they were horrible, but मैंने इतने गलत किए and then I had them down. By the end of the day, you could have asked me anything and I would know receptors, their pathways, ठीक है, how do they correlate, ठीक है, pharmacological principles जो उनसे apply होते, because मैंने physio की videos देखी, मैंने sketchy देखा, सारी YouTube videos मैंने देखी, मैंने अपने concepts को वो किया, and then I revised them with Anki for like 2 to 3 weeks straight. ठीक है, बिकॉज आई न्यू इस चीज पे मैं इतना स्ट्रगल करती हूँ. तो डोंट गो लाइक कि मुझे आ क्यों नहीं रहा, गो लाइक किस चीज में मैं स्ट्रगल कर रही हूँ. इज इट रट्टा, इज इट माई कॉन्सेप्ट, ठीक है, व्हाट आर दे ट्राइंग टू आस्क मी. सही है, एंड देन यू जस्ट रिंस एंड रिपीट, सो दैट.
Thank you so much, Dr. Rida. ये तो मेरा भी सवाल था. मैं MBBS में ये करती हूँ.
I
अच्छा,
swear.
लास्ट क्वेश्चन बुशरा की तरफ से है. ये काफी लंबा क्वेश्चन है. What if the triad I want to book is already ongoing? For example, if I want to schedule my exam in December, but haven't booked my triad yet, and plan on doing it in November after I am done with the NBMEs, can I still choose the October, November, December triad in November, or would it be November, December, January by then?
यार देखो, sort of मुझे सवाल समझ में आया है, but the thing is the seats get booked up and तुम्हें देखना पड़ेगा. A lot of people get seats a week before their exam. ठीक है, तो अगर नवंबर में तुम कर रही हो और तुम्हें दिसंबर का एग्जाम चाहिए, आई वुड से पता नहीं, बिकॉज इट रियली डिपेंड्स, इट डिपेंड्स ऑन योर रीजन. ठीक है, इट डिपेंड्स के क्योंकि सीट्स गेट बुक्ड अप लाइक दिस. ठीक है, तो मैंने तो पहले ही किया था, सही है. बट इफ यू आर वेटिंग कि मेरे एनबीएमयूज हो जाए फिर मैं करूं, अ लॉट ऑफ पीपल डू दैट. बट अगेन फिर द थिंग इज यू डोंट गेट फ्लेक्सिबिलिटी. जो डेट है फिर वही है. ठीक है, एंड अगर तुम्हें मंथ के शुरू में चाहिए या बीच में चाहिए एंड में चाहिए, फिर कुछ भी नहीं है ऐसा. एंड कभी कभी ऐसा होता है कि अ लॉट ऑफ पीपल आर स्ट्रगलिंग फॉर इट एंड आधे घंटे के लिए अवेलेबल होती है, एंड यू नो जाहिर है जिसने देख लिया उसकी हो गई. तो आई वुड से कि डिपेंड करता है, बहुत डिपेंड करता है.
लास्ट एक
Okay, I would
क्वेश्चन है, ये
like to
मुझे
add
ध्यान
here.
आया है. जी 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 जी, डॉक्टर
Second
रीच
time on
प्लीज.
motorway, so I have some internet issues. It really depends on your luck. I believe I got my exam booked 3 days before the exam. So keep
Yeah.
checking the
Yeah.
prometric,
Yeah.
and
Yeah.
you might get the date. So it really
Yeah.
depends on your luck too.
Yeah.
So yeah.
Yeah. Totally.
लास्ट क्वेश्चन मेरी फ्रेंड की तरफ से है. शी इज इन फाइनल ईयर, फोर्थ ईयर, तो उन्होंने फाइनल ईयर की एंड पे देना है, तो वो पूछना चाह रही हैं कि मैं किस तरह से फाइनल ईयर के साथ मैनेज करूं स्टेप 1 की प्रिपरेशन. आई थिंक शी
मुझे
इज
भी अच्छा, I would like to say I was in the same boat. Acha, okay. So I'm going to tell you my experience and then she can take from that what she will. So I started from 4th year. ठीक है, मुझे भी final year के end में था. I was like, oh मैं September में दे दूंगी, मेरे exam December में थे. तो मैंने कुछ नहीं पढ़ा था final year का. I don't know what her prep is, but the thing is she's in final year. The sheer amount, it goes like USMLE का syllabus and then final year का syllabus भी. ठीक है, and what was so sucky, and final year के syllabus is so much, it's so much. ठीक है, medicine and surgery, gynae ops, pediatrics, it kills you. तो I अगर उसकी final year की अच्छी तैयारी है तो फिर वो दे दे. मेरी नहीं थी, और जब मैंने तैयारी शुरू की थी I was like, oh, तो मैंने तो फाइनल ईयर के बाद ही दिया, क्योंकि मुझे वक्त, अगर मैं जनवरी अगस्त में अपनी फाइनल ईयर की तैयारी करना शुरू नहीं करती ना, मैं दिसंबर में थे, आई कुड हैव फेल्ड. और उसके बावजूद मेरे बहुत बैड एग्जाम हुए थे. तो आई वुड से इट्स वेरी सब्जेक्टिव, इट डिपेंड्स ऑन हर तैयारी. अगर वो साथ साथ फाइनल ईयर चला रही है देन वेल एंड गुड, फिर तो इशू नहीं होना चाहिए. बट अगेन इट डिपेंड्स, क्योंकि मैं तो साथ लेके नहीं चली थी. आई वाज जस्ट ऑल स्टेप 1 ऑल द वे, but it did not work out. So,
As we wrap up, I would like
Okay,
to
thank
express our deepest gratitude to our distinguished speakers, Dr. Khalid, Dr. Reej, and Dr. Rida, for sharing the expertise with us today, and especially for taking questions so patiently and clearing every confusion. You have addressed all the confusions and queries regarding USMLE Step 1 examination, and we're really grateful. Your contributions are greatly appreciated. Thank you so much.
Thank you everyone.
At the end,
Have a good day.
At the end of the session, I would like to invite you all to our next webinar on USMLE Step 2 happening on Saturday, October 5th. If you have enjoyed today's session, follow Ravish on Instagram at RavishNGO for updates on our free webinar series and other social initiatives. Thank you all for joining us today. Your participation made this event success, and we hope you now have greater clarity on USMLE Step 1. Have a great day ahead. Thank you.
thank you.